What is confirmatory testing after CF newborn screening? Imagine your baby has just had their first blood test, and the results show a possible sign of cystic fibrosis. What happens next? Confirmatory testing is the crucial step that helps determine if your baby truly has this condition. When newborn screening for cystic fibrosis is done, it starts with a heel prick blood sample taken within the first few days after birth. This test measures a substance called immunoreactive trypsinogen, or IRT, which tends to be higher in babies with cystic fibrosis. If the IRT level is elevated, the next step is usually to look for common mutations in the CFTR gene, which is responsible for cystic fibrosis. This genetic testing is done on the same blood sample and helps identify if the baby carries mutations linked to the disease. However, a positive screening result does not mean your baby definitely has cystic fibrosis. About 90% of babies who screen positive do not actually have the disease, so further testing is needed to confirm the diagnosis. The most definitive test used for confirmation is the sweat chloride test. This test measures the amount of salt, or chloride, in your baby's sweat. Babies with cystic fibrosis have higher levels of chloride in their sweat because of a defect in the CFTR gene that affects how salt is transported in the body. During the sweat test, a small amount of a safe, mild electrical current stimulates sweat production, usually on the forearm or leg. The sweat is then collected in a special container and analyzed in a lab. A chloride level above a certain threshold, typically 60 millimoles per liter, indicates cystic fibrosis. Levels between 30 and 59 millimoles per liter are considered intermediate and may requiring additional testing or follow-up. This test is performed at specialized cystic fibrosis care centers because it requires specific equipment and trained personnel. Confirmatory testing is essential because it provides a clear diagnosis, which allows for early treatment and management. Early diagnosis can improve lung health, nutrition, and overall quality of life for children with cystic fibrosis. It also helps prevent unnecessary worry or treatment for babies who do not have the disease. The process of confirming cystic fibrosis involves a combination of initial screening, genetic testing, and the sweat chloride test, ensuring the diagnosis is accurate and reliable. In summary, after an initial positive newborn screening for cystic fibrosis, the confirmatory test is the sweat chloride test. This test measures the salt in your baby's sweat and confirms whether they have cystic fibrosis. If the sweat chloride test confirms the diagnosis, your healthcare team can start early interventions to support your child's health. Always remember to consult with healthcare professionals for personalized advice and follow-up care.